Even though it's a nonprofit hospital, I think that the bottom line is for profit. The more they can line their pockets, the better. We're only asking for just a small portion compared to what they're paying the CEOs.
The leaders at St. Charles approached us and had asked us essentially to suffer together to weather the difficult economic downturn and not take pay raises. We were more than willing, but later from IRS documents it became apparent that they had continued to take substantial raises throughout this whole period of time. We were angry and unsettled, and I think there was a level of trust that was broken between us.
There have been peers of mine that have come. I'm a financial counselor, and so they've had to come to my desk, and in that regards they feel really embarrassed and very concerned about the fact that they can't even pay their bills, and they work for a healthcare facility.
We are getting bigger and bigger, but our staffing is getting thinner and thinner.
I work in environmental services, and we have lost most of our evening crew.
Well, a CNA friend of mine just recently came and shared this with us about a month ago, that she had been the only CNA on her floor, and there was 30 to 35 patients on the floor that night.
We recognize we're not spending as much time with the patients. We can't really, talk to them as long as they would like to talk sometimes when you take them back to the room. They have needs and stuff, and sometimes they're lonely and they just want to say a few things to you, and you kind of really have to get going because your workload is just way up there.
What we're asking for is a patient care committee, so we can have a say in staffing levels and how well the patients are being taken care of. Right now we have nothing in place to make sure that that is being done.